My role in creating the Indiana Minority Health Coalition goes back to its inception. In the mid-90s, several of us, healthcare providers, community advocates, policymakers were concerned about the status of African Americans and other minorities in the state. And the nation was also concerned about it too. In fact, the national level of Health and Human Services published a report on Black and minority health, and it showed that there were disparities in health for different minority groups compared to the majority population. And when we looked at, here in Indiana, when we looked at our health status, we found that it was very similar, that there were large disparities and gaps in health. Senator Billy Breaux and Representative Bill Crawford, as well as Representative Charlie Brown, were very instrumental in getting legislation passed that created a Black and minority health interagency council that looked at what all of the health problems were for minority populations.
The epicenter is actually in IMHC. It's a department within Indiana Minority Health Coalition, and part of the epicenter role is to also evaluate the programs that we fund, to look at the effectiveness. The epicenter is important because it allows the consumers to provide researchers with information that looks at some of the barriers they're experiencing in trying to get health services.
As director of the largest health department in the state of Indiana, and we are responsible for about 1.4 million residents in the state of Indiana. The Epidemiology Center for Indiana Minority Health Coalitions is of tremendous value and benefit. We know that the Blacks, Hispanics, Native Americans, and Asians will continue to accelerate in the United States, that by 2042, they will be the majority in this country. And the Epidemiology Center, what they're about is analyzing data so they can tell us about the trends going on in regard to health disparities. They have the ability to do research so that we can gain a better insight about what interventions or what strategies work in different racial and ethnic minority groups that nobody else has. Policymakers can look at this data and it can help guide policy decisions. It can help prioritize what initiatives we need to work on in the minority community.
Unfortunately, Native American demographic data has not been consistently collected here in the state of Indiana in particular. That's why the Epidemiology Research Center has been so critical and working with us in a partnership to assess health needs of Native Americans here in Indiana.
That we need to first be our own supporters. At the same time, and government recognized this to its credit, Indiana has made a major contribution. It's an outstanding state in terms of supporting the mission of the IMHC. We're priming the pump. We're investing in creating a effective, productive, contributing citizen through that process. And then the business community needs to step up to the plate. If they have workers that are subject being less productive because of health conditions, it's beneficial to them. And everyone should support not only the IMHC, but a healthy state. The former governor and the current governor are both saying that health is an important component of progress and productivity, and the business community and everyone recognizes it, so we just have to operationalize the health studies and hopefully health solutions.
From the scientific community, we collect a lot of data, and often what we're doing is looking at numbers. But we have to understand that there are faces behind those numbers. And one of the aspects that really makes us feel good as researchers is when we can see definite improvements in the community because of the data and the programs that have been developed. Because there you can see very specific successes. People are getting better services, they're getting access to care that they didn't have before, their health is improving, their healthy behaviors are improving, and we expect the quality of their life will improve, and consequently morbidity and mortality will decline over time.
Throughout my tenure in the Indiana General Assembly, I have served on the Health Committee and many years served as the chair of the Health Committee, and has always been an advocate for health. And one of the major projects was getting funding for the epicenter. My contention is that everyone needs health care, and mainly to be talking about preventive areas, and therefore I'm a strong advocate.
I have been a great supporter of the Epicenter since its inception. As Attorney General, I actually provided the funding for the beginning of the Epicenter in a grant. It was actually tobacco dollars that we provided as a grant for the start of the Epicenter.
We appreciate all the support that we've been shown in the development of the infrastructure of the Epicenter over the past years, and some of the services that we're able to provide through the Epicenter. But we do need additional support or continued support of some of our funders going into the future so that we can enhance the infrastructure as well as expand the services to other counties throughout Indiana.
The mission is not complete, and to complete the mission we need continuing support. We appreciate all those who have contributed in the past. We solicit this continuing support of people as we move forward to create greater and more healthy citizens in Indiana, which contributes to the economic and educational and hopefully spiritual growth of all the citizens of our state.
The state of Indiana definitely needs the data that's generated from this epidemiology center. It will enhance the quality and improve the health of the residents of Indiana. It is such a tremendous tool and asset for the state of Indiana. We have to continue that strong support.
As a director of Latino Health Organization, I believe it's very important to get funds to the Epicenter, because that way we can serve to the community, to Latino community, and they can get better health and better life. And, you know, we believe that is very important in Indiana.
The reason that it's important to increase the amount of funding for the Epicenter is because it provides one of the most targeted sources of research in the African American community. We know that African Americans have a higher incidence of many diseases, diabetes and other diseases. And to the extent that that is true, it's important to be able to research and to get the correct amount of research so that the health care can be provided. It is an important aspect. The first step is to get the research and know how to target the services, and the second, of course, is to target the services.
The funding for the Epicenter is very, very important. I, as an individual, and the Indiana Black Legislative Caucus will make every effort to increase and maintain the continued funding for the Epicenter, because it is of such value to our population here in the state of Indiana.